everyone, happy afternoon, a very good afternoon. I hope and I believe all of you are doing well. A quick nod whether the audio visual is all good. Right. Am I able to see the live chat? I was not able. Okay. All right. So, no sound. Am I audible and visible? All good. Okay. So today in this session, we are gonna discuss quickly revise, like your last minute revision that you would do for the TNM staging of the gynecologic cancers, which is important. That is CA cervix, endometrium, and the CA ovary. So three cancers that we are going to quickly revise here. There are two TNM staging that I have taken in the Plus course on Unacademy. All the Plus subscribers, please watch that as well. CA breast and CA oral cavity. So the tricks to remember this has been covered in the Unacademy Plus course, basically for the subscribers. So I hope all of you now are on the Unacademy Plus and you all are aware that we have the ongoing Unacademy Learning Festival where each one of you can take a Plus subscription at just $299 for 1 month. And I think this is something that you all should avail. And this is available only till tomorrow. So even if it's your last 1 week before NEET PG or last 15 days before your FMGE, I want each one of you to make the best use of it. Right, this is gonna definitely help you. Even if your NEET PG is over, the 1 month subscription, the remaining days you can utilize and you can watch the videos after the exam, of course, after a break. If you are planning for the next INICT, and all undergraduate students should also see that. Okay. And today we are gonna meet again. It's a Sunday, but no fun day. Sunday before the exam is no fun day. It's all studies. So 5 p.m. and 10 p.m. is when we will meet again. 5 p.m. Now, because in the daily targets, the timetable that we have, it's pharmacology. So my target is ki in these two sessions, initially, I was planning to do the rest of the PSM, but I believe that 1 hour will not be enough for pharmacology. So 5 p.m. and 10 p.m. it's gonna be your quick revision of pharmac, whatever is important, including your antimicrobials, anti-cancer, general pharmac and numericals, and a quick revision of CVS, CNS pharmacology, whatever is important. We'll try to do in these 2 hours today. So it's gonna be pharmacology day today, and major important topics will be covered. Okay. All right, what's happening, Sharad? 2 months is coming, 1 month is not coming. Let me update the link. Try on that. I'll update the link in the comment section for the subscription. See if that works. Okay. All right. Pharmacology हमारा सब कुछ आज I'll try to cover. CA breast and oral cavity ka link I'll share after this session on the Telegram group. Just remind me on the Telegram group if at all I forget that. Okay. So hoping to see you all at 5 p.m. and 10 p.m. on the Unacademy Plus. And while you are subscribing, to avail this offer, you need to use the code, and you can use the code Dr. Nikita. Okay, Dr. Nikita. So this is gonna be helpful to both NEET PG students also and FMG students also. Both the students should attend the today's evening classes also. All right. So let's start with the staging. I'll tell you some quick tricks on how to remember cervix, ovary and endometrium ka staging because it's very volatile. So some quick tricks on that. So in the CA cervix, right, so all the cancers basically have stage 1, stage 2, stage 3 and stage 4. So when is it your This live will be on which batch? We have the ongoing mnemonics course. For those who are not aware, I'm taking your dedicated like mnemonics crash course on the Unacademy Plus platform. There are 3 courses in total. One we started on 2nd May, one on 11th May, and another one will start on 19th May. FMG students should definitely attend all of these, and this one is specially for you. So ये ongoing course में mnemonics वाले में ये cover करेंगे. ठीक है? Now stage 1. Stage 1 is basically the cancer confined to the cervix, right? Now remember that in any cancer, stage 1 means it is confined to that organ. Okay, it's confined to that organ. So if I talk about CA cervix and CA endometrium, right? CA cervix and CA endometrium. So stage 1 of CA cervix means it is confined to the cervix. Stage 1 of CA endometrium means it is confined to the uterus till the myometrium. Remember, it is till the myometrium. Serosa is not included in your stage 1 of CA endometrium. Now, even in your stage 1 of the CA cervix, if I tell you that from the cervix, the tumor has gone and involved the uterine body, then is it your stage 1 or is it your stage 2? If the CA cervix has gone and involved upper, the uterine body, is it stage 1 or is it stage 2? Am I able to see the live chat? Why am I not seeing your comments? Right. No. So please remember that it is the difference is in a case of CA cervix, if the uterus body is involved, it is still your stage 1. It does not change the stage of the CA cervix. But in a patient of CA endometrium, if the cervix is involved, then it is stage 2. So please do not make a mistake here. Remember, that's the difference. Cervix में अगर uterus include हुआ, that is still stage 1. But in CA endometrium, if it is cervix involvement, then it is your stage 2. Okay, then it's your stage 2. All right, so going to this one. So stage 1 is confined to the cervix. Extension to the uterine corpus should be disregarded. Okay, that is disregarded. 1A and 1B. This is what you have in stage 1. Let me show you this diagram first and then we'll come to this. So look at CA cervix ka. Stage 1 is confined to cervix, uterine body involvement. It does not change. While in CA endometrium, it is stage 2. Stage 2, you have 2A and 2B. Now remember that when I say 2A, it is all AA. So vagina involvement, AA, vagina involvement in a patient of CA cervix is either 2A or it is 3A. So another point to be remembered, कि when it is vagina involved, I want all of you to make the notes simultaneously, 1-page notes for these 3 cancers. Okay. So vagina involvement AA is basically your stage A. It can be stage 2A or it can be stage 3A. When it is the upper 2/3 of vagina, cervix से जब नीचे जाएगा पहले upper vagina will be involved, it is 2A. When it is lower 1/3 vagina, then it is your stage 3A. So vagina involvement is stage A, 2A or 3A. The B wala stage is basically your P wala stage. 2B is your parametrium. B for P, that is parametrium. 3B is what P here, that is pelvic wall. So first will come parametrium, then will come the pelvic wall. So if it is parametrium, it is 2B. If it is going till the pelvic wall, then it is 3B. Okay, then it's your 3B. So when it is going to the pelvic wall, it involves the ureter and that causes your hydronephrosis. Hydroureter hydronephrosis, very, very important. Remember, that's your stage 3B. Okay, that's your stage 3B. Now, in your gynecologic cancers, also remember that the involvement of retroperitoneal lymph nodes and the involvement of inguinal lymph nodes is given as what staging? Retroperitoneal lymph nodes versus the inguinal lymph nodes is what staging? So remember that involvement of retroperitoneal lymph nodes is stage 3. Okay, that is your stage 3. And involvement of inguinal lymph nodes for these 3 cancers, this is considered as stage 4B. Inguinal lymph nodes are basically considered as distant lymph nodes. It is not your, not in stage 3. So important, retroperitoneal is stage 3, inguinal is stage 4B. So look at this one. So basically, if it is retroperitoneal lymph node involvement, it is your C. What is included here? Pelvic and para-aortic lymph nodes. Pelvic and para-aortic lymph nodes. And what is your stage 4A and stage 4B? 4A, matlab going to adjacent organs like the bladder and the rectum. It is not just the edema. It should be like biopsy proven involvement. It's not just the edema which is included. And 4B is distant organs like the liver, lungs, supraclavicular lymph nodes, and even your inguinal lymph nodes. Okay, even your inguinal lymph nodes. So that is what you need to remember in the staging of CA cervix. Very, very important. What did we learn is, if it's a CA cervix going to the uterus body also, it is stage 1. Okay, that is your stage 1. Next one, if it is going, what is stage 2 now? What is stage 2 for the CA cervix? You have 2A and you have 2B. 2A is vagina involvement. The upper vagina involvement is 2A, and 2B is basically your parametrium involvement. Okay, parametrium, B is P, parametrium involvement. Next one, 3A, 3A, 3B and 3C. So 3A again is the vagina involvement, the lower one. 3B is, this is going further to the pelvic wall and involving the ureter causing hydronephrosis. And 3C is basically the lymph nodes, the pelvic and the para-aortic lymph nodes. That is your retroperitoneal lymph nodes. What is 4A and 4B? Okay, what is 4A and 4B? 4A is the adjacent organs, be it the bladder or be it the rectum, 4A. And 4B is basically the inguinal lymph nodes and the distant organs including liver and the lungs, basically all the distant organs. Okay? So we are done with your CA cervix staging. Everybody is clear with this? One is confined, including to the uterus body also, right? This is basically stage 1. This is stage 1. 2A, 2B, vagina parametrium, 3A again vagina, and B is your pelvic, and 3C is your retroperitoneal lymph nodes, right? Now going to the next one. So look at the images also here. Confined to the cervix is stage 1. And remember, this can be 1A and 1B. Okay, this is 1A and 1B. Now in the new staging that we have for CA cervix, remember it is the depth which is important. The width is not included in the staging. It's only the depth. So out of that, 1A is basically till your depth of 5 millimeters. If it is more than 5 millimeters, then it is 1B. And what we have added in your 1B is a stage 1B1. So less than 2 centimeters, 2 to 4 centimeters, and more than 4 centimeters. This is your 1B1, 1B2 and 1B3. So why we have added this 1B1 is because it was found that if it is less than 2 centimeters, remember this important point, that if the tumor is still the size of 2 centimeters, we can do radical trachelectomy. We need not do your entire hysterectomy. Even that gives a good survival in that case. So up to 2 centimeters, trachelectomy. Up to 4 centimeters, basically we do surgery as a treatment. If it is more than 4 centimeters, then surgery is not done. Okay, surgery is not done. So for 1B3, which is more than 4 centimeters, surgery will not be done. Now for your 2A, okay, you have 2A1 and 2A2. This is less than 4 centimeters, more than 4 centimeters. So even for 2A1, we will do the surgery because it's less than 4 centimeters. Okay. Parametrium is 2B, 3A is 1/3 of vagina, 3B is your pelvic wall, hydronephrosis, 3C is your pelvic and para-aortic lymph nodes, 3C1 is pelvic, 3C2 is para-aortic. And then you have your bladder, rectum and the distant organs. Now going to the staging of CA endometrium. That was about CA cervix. Now when it is CA endometrium, in the CA endometrium, stage 1 confined to the uterus. What do we mean by confined to uterus? That means only till the myometrium. The serosa is not involved, only till the myometrium. So So up to half the thickness of the myometrium, that is your stage 1A. If it is more than half, it is stage 1B, right? What is stage 2? Now stage 2 is first the tumor going down, that is the cervix. What is stage 3? In 3 you have 3ABC. Similar to your CA cervix, the lymph node involvement is your stage 3C. Pelvic lymph nodes, para-aortic lymph nodes. What is 3A and what is 3B? So remember that 3A is your horizontal spread. So involvement of the serosa or the adnexa, that is your stage 3A. So serosa is 3A. 3B, that means the tumor now going adjacent to the cervix. So either the vagina or the parametrium involvement. Okay. So remember that 3A is basically horizontal spread, serosa, adnexa. 3B is cervix ke aaju baju, that is your parametrium and the vaginal involvement, that is 3B. 4th stage is basically your pelvic wall involved. Okay, pelvic wall in your CA endometrium is your stage 4, okay, which is stage 3B in cervix. Lower 1/3 of vagina and hydronephrosis, this is basically your stage 4. So 4A is bladder bowel mucosa and 4B is distant, including inguinal lymph nodes. So the diagram here, what is written? Stage 1 is basically your stage 1 is confined to the uterine body. Cervix is not included. Cervix is basically your stage 2. And even in the cervix, it should be cervical stroma involvement, not just the endocervical glands. If it is endocervical glands involvement, it is still stage 1. To call it stage 2, it should go in the cervical stroma. In the stage 1, less than 50% myometrium, that is stage 1A. More than 50% is stage 1B. If the serosa is involved, horizontal spread, it's your stage 3A. Serosa adnexa AA again is your stage 3A. Niche cervix ke aaju baju is your stage 3B. Parametrium vagina. 3C, like the CA cervix, is retroperitoneal lymph nodes. 4A adjacent, 4B distant organs. Clear with everyone? What is the difference between CA cervix and the CA endometrium? So suppose if I ask you the difference, CA cervix versus CA endometrium. Parametrium involvement is what stage in CA cervix and what stage in CA endometrium? Parametrium involvement in CA cervix is what stage? Parametrium involvement in a case of CA cervix. For cervix, parametrium is present very near. So that will be your early wala stage, that is stage 2B. Remember, B is P. For endometrium to come from up, then it will go to the cervix and then it will go to the parametrium. So that is why that is your stage 3. What is it, stage 3A or stage 3B? That is your stage 3B. Okay, that is your stage 3B. Okay, that is your parametrium involvement. The retroperitoneal lymph node involvement in both of these is your stage 3C. Okay, that is your stage 3C. How about the vagina involvement? Vagina involvement in a case of CA cervix, it is upper is 2A or lower is 3A. Here the vagina involvement again is your stage 3B. Cervix ke paas mein jaane wala, that is your stage 3B, or it can be stage 4A if it is the lower vagina. Okay, if it's the lower vagina. All right. So very, very important. Remember all of this. Even the pelvic wall involvement, here it is stage 3B. Here it is gonna be your stage 4A. Okay. Now going to the next one, that is CA ovary ka staging. Okay, for CA ovary. Again your stage 1A, 1B, 1C, you have 2A, 2B, 3A, BC and stage 4A, 4B. So basically remember that in CA ovary, stage 1, 2, 3, 4, the odd numbers 1 and 3, they have the ABC staging. Isme hota hai ABC, ABC. 2 and 4, 2 wala has only 2 and 4 wala has only 2, 2A and 2B. Now CA ovary staging is a bit different from the rest of the two. Ovary is present separate from the uterus and the cervix, right? So it's a bit different here. What is different here? Stage 1, is basically 1A is one ovary, tumor limited to one ovary. 1B is both the ovaries. Okay? Now 1C, whether it is one or both, that does not matter. But remember that if there is ascites, malignant ascites is what stage? Remember, ascites is CI, I is like 1, it is stage 1C. If it is malignant ascites, it is your stage 1C3. Ascites wala malignant cells. In your 1C, basically 1C1 is surgical spill, 1C2 is tumor on the ovarian surface already. So 1C1, okay, what is 1C1, C2 and C3? Out of that, C3 means is the highest. The tumor has already gone and it is causing ascites. C2 means it is present on the surface. It's still on the surface. One matlab, there was no tumor on the surface, but only during the surgery the spill happened. So basically on the surface or spilling outside, that is your stage 1C. So remember, C is basically the spill. C is the spill. Stage 2 is basically your pelvic extension, below the pelvic brim if it is involved, or your primary peritoneal cancer. Stage 2, basically for ovary, आजू बाजू में you have the uterus and you have the fallopian tube. So fallopian tube and uterus involvement is stage 2A. The rest of the pelvic organs, remember in your ovary, the rest of the pelvic organs becomes your stage 2B. Okay, that becomes your stage 2B, not your stage 4B. Stage 3 again basically relates to your retroperitoneal lymph nodes and the peritoneal metastasis, because in ovary we know that it's very, very common that the patient presents with ascites. There are these peritoneal deposits on the liver surface, spleen surface, they are very common. So we include your peritoneal metastasis also. If it is retroperitoneal lymph nodes, then it is your stage 3A. Stage 3A is retroperitoneal lymph nodes. Stage 3B and C is your peritoneal metastasis but macroscopic. If it is microscopic, it is stage 3A2. So remember that basically retroperitoneal lymph nodes is stage 3A1. Peritoneal metastasis, it could be microscopic, it could be macroscopic. Micro is your stage 3A2, macro is your stage 3B and stage 3C. If it is less than 2 centimeters, it is stage 3B, more than 2 is your 3C. So macroscopic extrapelvic peritoneal metastasis. We are talking about extrapelvic, that is above the brim. That is your stage 3B. So it includes your capsule of the liver and spleen also, right? Next is your stage 4, very, very important. Now in your CA cervix and endometrium, we said that 4A is spread to the bladder and rectum. But in a case of CA ovary, the pelvic organs are already included in stage 2B. So what is stage 4A here? This is pleural effusion with positive cytology. Okay, pleural effusion, that is your positive cytology. And 4B is basically the rest of the organs, hepatic, splenic, parenchymal metastasis, inguinal lymph nodes again is stage 4B. Okay, or the lymph nodes outside the abdomen like supraclavicular. So what did we learn in a case of CA ovary? Okay, remember what are we learning in a case of CA ovary? Ovary ke liye stage 1, okay, stage 1 basically confined to the ovary. 1A means one ovary, 1B means both the ovaries, and 1C is basically relating to the spill or the presence on the surface or the ascites. This is 1C1, 1C2 and 1C3. What is stage 2 for CA ovary? For the ovary, the adjacent structures are fallopian tube and the uterus. So that is your fallopian tube or the uterus. This is your stage 2A. If it goes to the rest of the organs in the pelvis, that is your stage 2B. So basically the tumor is still in the pelvis only. Okay, still in the pelvis. For stage 3, you have stage 3A, B and C. Retroperitoneal lymph nodes is stage 3A. Microscopic peritoneal deposits, that is your stage 3A2. This is 3A1. 3B and 3C is your macroscopic deposits, including the deposits on the surface of the liver. If it is less than 2, 3B, more than 2 is 3C, right? If the metastasis is under in the parenchyma, then it is your stage 4B. For the CA ovary 4A and 4B, 4A, it's not your spread to the rectum or the bladder. It is basically pleural effusion. And 4B is your organ involvement, distant liver, spleen, lung involvement, or even your inguinal lymph nodes. Inguinal lymph nodes everywhere, it is your stage 4 in cervix, endometrium, and ovary. Okay, that is your stage 4. So this is what it is. So remember, stage 2 is uterus or fallopian tube, other pelvic organs. 4A is pleural effusion, 4B is liver, spleen, and inguinal lymph nodes. Okay, inguinal lymph nodes. So look at these important points. If it is the liver, spleen, surface means the peritoneum. So that is your stage 3. Peritoneum is stage 3, extra pelvic peritoneum. Liver, spleen, parenchyma is stage 4. Inguinal is stage 4B. Retroperitoneal lymph node in a case of ovary is 3A. Cervix and endometrium is 3C. Malignant ascites, CI, it's your 1C3. Pleural effusion is stage 4A. Okay, that is your stage 4A. Now, let us try solving some questions here. Okay. If I tell you that this is the image that is given and they tell you that this is a patient of CA cervix, what stage of CA cervix do you think is this based on this image? Based on this image, what do you think is the stage of CA cervix? CA cervix, what do you see in this image? What is this image showing basically? See, in this CT scan image, what are we seeing is this is the kidney and this is the kidney showing the hydronephrosis. This is the ultrasound image showing the hydronephrosis. Okay, ultrasound image showing the hydronephrosis. So basically this is hydronephrosis in a case of CA cervix. Remember, it is your stage 3B, which is involvement of pelvic wall, or it is your hydronephrosis, hydroureter. Okay, that is your stage 3B, right? This one, in a case of CA cervix, the tumor going to pelvic wall, that is your stage 3B. If it's only the parametrium, that is your stage 2B, right? That's your stage 2B. Going to this one, this is your stage 3B again. Tell me what will be answer to this? Involvement of lower 1/3 vagina in a case of CA cervix is what stage? Lower 1/3 vagina in CA cervix is what stage? Absolutely right. That is your stage 3A. Remember, in a case of CA cervix, the involvement of vagina is all AA. That is your 2A and 3A. 2A is upper vagina, 3A is lower vagina. Okay, 2A is upper and 3A is lower. So that's your stage 3A. R and P suffix are used to annotate which stage of CA cervix? Where is R and P used? Remember, R and P basically is used for whether you have seen the retroperitoneal lymph nodes radiologically or you have confirmed them pathologically. And what is the best investigation? It says, the guideline says the best for retroperitoneal lymph node is your PET CT. Okay, PET CT is the best. So retroperitoneal lymph node basically is your stage 3C in CA cervix or CA endometrium. In a case of CA ovary, remember retroperitoneal lymph nodes is stage 3, but it is stage 3A. Stage 3C in CA ovary is your extra pelvic peritoneal deposits, right? It is peritoneal deposits. Next one, endocervical glandular involvement in a case of CA endometrium is what stage? Endocervical glandular involvement in CA endometrium is what stage? Right. See, in a case of CA endometrium, if the cervix is involved, it has to be cervical stroma to call it stage 2. If it's only the glands which are involved, then it is still stage 1. Okay, it is still stage 1. Serosa involvement in a case of CA endometrium is? What is your serosa involvement? So you have endometrium, you have cervix, endometrium wala going out to the serosa, going to the adnexa. Serosa and adnexa, AA wala is your stage 3A. What is stage 3B? Going adjacent to the cervix, parametrium, upper vagina, that is your stage 3B. Right, so that is your stage 3A. Stage 2 in CA endometrium is your cervix involvement, right? The cervix involvement. ठीक है? Cervical stroma invasion, endometrium going down, that is your stage 2. Okay, that's your stage 2. Parametrium involvement is what stage in CA endometrium? Parametrium involvement in CA endometrium and CA cervix. For the cervix, parametrium is very close, so early stage, stage 2B. And for endometrium, it first goes to the cervix, stage 2. After that, it goes into the parametrium, so that is stage 3B, right? That is your stage 3B. Okay, that's your stage 3B. Clear with everyone? 3A is your serosa and adnexa, horizontal spread. Vagina involvement, specifically the upper vagina involvement, that is your stage. What is your upper vagina involvement in a case of CA endometrium? In a case of CA endometrium, the upper vagina involvement is same. That is your stage 3B. Okay, that's your stage 3B. Stage 3B. Okay. Stroma, cervical stroma is stage 2. Full thickness myometrial involvement is what stage of CA endometrium? Full thickness myometrial involvement is what stage? Right. Is it stage 1, stage 2? Endometrium still confined to the myometrium, that is your stage 1. If it is full thickness, that is your stage 1B. Remember, stage 2 is endometrium going to the cervix. Positive pelvic lymph nodes without a para-aortic lymph nodes is what stage? We are talking about pelvic lymph nodes, para-aortic lymph nodes. These are basically retroperitoneal में हम involve करते हैं, and it is your stage 3C for cervix and the endometrium. If it's only pelvic, this is 3C1. 3C2 is your para-aortic lymph nodes with or without pelvic lymph nodes. That's your stage 3C1. Para-aortic lymph nodes is your stage 3C2. Okay. Inguinal lymph nodes always is your stage 4B for these 3 cancers. Okay. This is your CA ovary ka diagram, and CA ovary mein let me show you the MCQs if we have. Tumor on the surface of ovary is what stage? Tumor on the surface of the ovary. It is in the ovary but on the surface. That is what stage? That is your stage 1C2. So C is surface, spill, surface, or the ascites. That is your stage 1C1, 1C2 and 1C3. Right? C is basically related to your 1C is surface, spill, ascites. Involvement of liver surface is what stage of ovarian cancer? Involvement of liver surface is what stage of ovarian cancer? Right. Remember, we are talking about liver surface. That's basically the peritoneum. The extra pelvic peritoneal deposits is stage 3. If it is liver parenchyma, if the parenchyma is involved, then it is your stage 4. Okay, then it's your stage 4. Involvement of rectum in CA ovary, it's a pelvic organ itself, aju baju ka pelvic organ, that's gonna be your stage 2. Retroperitoneal lymph nodes in ovarian cancer is your stage 3. Okay, that's your stage 3A. 3A in ovary. Inguinal lymph nodes is stage 4B. For all these cancers, it is your stage 4B. Pleural effusion is what stage of ovarian cancer? That is your stage 4A. 4B is basically your lungs involvement, supraclavicular lymph nodes. All this will be your stage 4B. Pleural effusion is stage 4A. Okay, remember that. All right, so that was about your 3 most important cancers. Just remember the anatomy, then you'll be able to remember ki if it is the cervix ka cancer, where will it go first? If it is endometrium cancer, where will it go first? So remember, cervix wala, if it goes to the uterus, it is still stage 1. Stage 2 is basically your aju-baju vagina and parametrium. Then you have stage 3, again, which is your lower vagina, pelvic wall. Stage 4, we all know. For the endometrium, if the cervix is involved, it is your stage 2. 3A is the horizontal spread, serosa and adnexa. 3B is parametrium, upper vagina. Okay. And all of these, the retroperitoneal lymph nodes is stage 3. Stage 3C in cervix and endometrium. Stage 3A in your CA ovary, in the CA ovary, right? So that was about this quick discussion of these 3 important cancers. Please make the notes and write it down in one page so that you can revise it one day before the exam also. Okay, you can revise it one day before the exam also. All right. So as discussed, we are gonna meet again. All right, so we are gonna meet again at 5 p.m. and 10 p.m. The focus in the today's class would be predominantly on pharmacology. 2 hours, majority of pharmacology that we can cover, we'll try to do. Surya liver surface in a case of CA ovary is stage 3 because it's a peritoneal involvement, right? It's a capsule peritoneal involvement. And do not forget the Unacademy Learning Festival only till tomorrow. Just $299, you get your 1 month subscription. You have a lot of important videos to be watched on the platform. Okay. Thank you so much, everyone. Goodbye. Take care. I hope this TNM staging, at least for these 3 cancers, is now easy. And as I said, revise it one day before the exam. All right. So goodbye.